This lecture, dear students, we will discuss the arrangement of artificial teeth in class 2. We have been discussed last week the arrangement of artificial teeth in terms of class 1, natural occlusion, and lingualized occlusion. And we discussed all the steps that we need to positioning the upper and lower teeth in terms of intercuspation. Now, what I would like to say for the next, for today lecture and for the next week, uh, to put in your mind that the setting of upper arch will be the same in class 1, class 2, and class 3. The difference only with the class 2 and class 3 is on the lower, in the setting of the lower teeth, because within the class 2 and class 3 we have the positioning of the maxilla in class 2 a little bit forward than the mandible, as in the class 1, the natural or the most commonly popular case. In class 3 there is an edge to edge and the protruding of the mandible over the upper maxillary arch. Now, with the setting of teeth in natural occlusion with the class 2, this is the posterior relationship of the mandible to the maxilla. And with natural teeth, the mesio-buccal cusp of the first upper permanent molar occlude mesial to the mesio-buccal groove of the lower first permanent molar. In complete dentures, a normal relationship is maintained between the upper and lower posterior teeth. However, because the lower arch is narrower in case of class 2 than the upper arch, because of the posterior relationship of the mandible to the maxilla, a normal relationship between the upper and lower teeth cannot usually be achieved if the teeth are to be placed over the most stable part of the upper and lower ridge. Okay? Now, to achieve a reasonable occlusal relationship while maintaining the teeth in the most stable position over the ridges, the central foci of the lower posterior teeth must be extended buccally by grinding. So, within the setting of artificial teeth in terms of class 2, there are a little bit grinding within the teeth. So the upper palatal cusp and the lower buccal, the lower posterior teeth must be extended by grinding. This to allow contact between the upper palatal cusps and the lower buccal foci. This usually means there is no contact between the upper buccal cusp and the lower palatal cusp with their antagonist, which would be the case as in a class 1 relationship. It also means that the much larger buccal overjet is seen than normal, as shown as in the image, of course, on the right side. You can notice from the image that the upper maxillary arch protruded than the lower. So in terms of achieving a successful, stable denture, we need to arrange the teeth in different steps than that with the class 1. Now, in class 2 setup usually exhibit reduced space for the mandibular incisor. Okay, it is better to place 5 anterior teeth. So in terms of lower anterior teeth, as I mentioned, the setting of upper maxillary teeth within the normal, as in class 1, the different will be within the lower teeth, and particularly the anterior teeth. Sometimes there are many theories regarding the position of the molar, which is mesially to the upper or distally, because the lower is narrower than the upper maxilla. Okay. Now it is better to replace the spaces, or to reduce the spaces between the teeth by placing another additional anterior tooth, which it is probably become five anterior teeth of the correct size to match the maxillary teeth. Now then, to select a smaller set of mandibular teeth. Uh, so it's, instead of using a smaller size of artificial teeth to be set in the lower arch because of the narrow arch, we can reduce the spaces between the teeth by adding additional tooth from the same size that we've used for this case. It is sometimes, alternatively, it is sometimes better aesthetically to leave off the first premolars and replace them with mandibular canines. And at the image on the left side, A, you can notice that behind the lateral, the canine. So this is the alternative way for aesthetic purposes. Otherwise, this will become really class 2, more clear that there is a space between the upper and lower, and the case showing the class 2, the actual class 2. Now, the first premolar replaced with mandibular canines, which can be placed to articulate better with the maxillary first premolar. Now, the aesthetic are also improved even if 7 mandibular anterior teeth are placed. And you can notice on the image on the right side, there are 7 lower anterior teeth starting from the canine to canine. One extra tooth or one less tooth will not usually be noticed by anyone looking at the patient, because that we have already the bisecting line within the maxillary arch. So with the high lip line, only the upper will be appear for aesthetic purpose, and a few people, maybe the professionals, can notice that the lower teeth are not symmetrical and there are too many teeth at the lower arch. Besides that, we have many cases with supernumerary teeth as well, and this will be normal. For example, now the overjet and overbite are in the overjet and the overbite inevitably larger than the usual. That's mean 2 millimeter recommendation. However, it is important that the lower teeth remain in the natural zone, and that occlusal forces are directed down to the long axis of the teeth. The image on the left side, look to the teeth, dear students. They are arranged in proper way within the neutral zone, and the occlusal force will be directed down the long axis of these teeth onto the lower ridge. Maintaining this, the setting of teeth within the long axis, within the neutral zone, maintaining stability of the denture. It is still possible to achieve this by proclining the teeth a little bit forward slightly to enable an age-to-age relationship of the incisor teeth during biting. In these class 2 cases, it is sometimes tempting to position the lower teeth too far forward to try to allow better contact between the anterior teeth during protrusive biting, in terms of protrusive in biting or excursion on the lateral left and right. This can lead to instability when incising food because the biting force are not directed back onto the ridge. So labially placed teeth may also interfere with the movement of the lower lip, particularly as it moves when pronouncing E sound, which is important to have the lower lip, the movement of the lower lip in pronouncing such letters. So this is in terms of natural occlusion. So we can substitute the vice versa premolars, the canines. We can replace. We have instead of using the small size of artificial teeth, we can use the super numerary teeth, multiple anterior teeth to replace to reduce the spaces that we have in the lower arch. Now, what we have with the lingualized occlusion in term of class 2 as well. So, in term of a class 2 malocclusion, relationship, class 2 relationship between the upper the maxillary mandibular arch, and there are severe resorption in the bone, we need to set the teeth in the longalized occlusion. And as I mentioned, the setting of teeth in natural occlusion class 2 depend on the mandibular positioning of the mandibular artificial teeth. Now, with a class 2 relationship, inevitably mean that when positioning the premolar teeth, the lower premolars are positioned more lingually. That means we already said that should be the long axis within the long axis of the residual ridge and the neutral zone. But in terms of lingualized occlusion, a little bit tilting to the lingual side than would be in the case for class 1 and class 3 later on. This usually means that the central fossa of the upper first premolar has to be enlarged palatally, okay, to allow the lower premolar to contact it while still being positioned over the crest of the lower ridge. Now, the remaining teeth may also need to be adjusted a little bit. The central fossa of the lower second premolar and molar teeth may need to be adjusted to be more buccally placed to allow correct positioning of the teeth over the ridges and contact between the teeth. There is always, dear students, more leeway. Leeway is the space that we have between the upper and lower teeth when placing the upper teeth, because the upper ridge is wider than the lower. Now, the room for the lower anterior teeth in class 2 cases is usually reduced compared to class 1 and class 3. Of course, later on we will discuss that. It is much better to place 5 anterior teeth of the correct size than to try to place 6 teeth that are too small. So what we need to focus on, dear students, that in class 2 lingualized occlusion, placing the teeth a little bit lingually than the class 1. Whether we are using in class 1 a little bit lingually, in class 2 a little bit more than in a class 1 moving the teeth lingually with the adjusting of the other teeth. And of course, remember always to add additional tooth with the same size, better than using the teeth of a small size. Now, the quiz for next week is how can you arrange the maxillary and mandibular artificial teeth in a class 2 relationship? And of course, as I mentioned previously, if I didn't mention whether this will be in natural occlusion or lingualized occlusion, so your answer will be, of course, for both of them. Thank you for listening for this lecture, and be prepared for next week to discuss the setting of artificial teeth in terms of a class 3 relationship.